topic is vaccines and immunization. Um, August, as we all know, is the Immunization Awareness Month. So let's start. This is the outline of today's webinar. We'll go over 5 main points. I would like to start with some myths and facts, and I will post 3 questions for you to answer. So the first question is, myth or fact, natural infection is better than immunization? And we'll give it about 20 seconds for answers. All right. Okay. So the second question is, myth or fact, it is always best to get vaccinated even when you think the risk of infection is low. Five more seconds. Okay, we'll close that one. The last question is, if we stop vaccination, deadly diseases will return. We'll give it 20 seconds. All right, I got all the answers. Thank you for that. Now we'll go ahead and proceed to the next slide. Okay, we have some terms and definitions here that we're going through. If you guys have any questions, feel free to type them in the chat, and I will go ahead and read them after we're done with the webinar with the slides. So the first one is immunity, protection from an infectious disease. So if you are immune to a specific disease, that means you can be exposed to it without becoming infected. The second term is vaccine. It's a product that stimulates a person's immune system to produce immunity to a specific disease, protecting the person from that specific disease. Vaccines are usually administered through needle injections. Sometimes they're drops through the mouth as well. Vaccination, it's the act of introducing a vaccine into the body to produce immunity to a specific disease. And the last term that we have here is immunization. And it is a process by which a person becomes protected against a disease through vaccination. This term is often used interchangeably with vaccination or inoculation. Okay, we have some facts or some um, statistics here. So before the middle of the last century, diseases were, for example, whooping cough, polio, measles, rubella struck hundreds of thousands of infants, children, and even adults in the US. Thousands died every year from them. So as vaccines were developed and became widely used, rates of these diseases declined until today. Most of them are nearly gone from our country. So these are some statistics and numbers from the CDC. Nearly everyone in the US got measles before there was a vaccine, and hundreds died from it each year. Today, most doctors have never seen a case of measles. The second one is more than 15,000 Americans died from diphtheria in 1921 before there was a vaccine. Only 2 cases of diphtheria have been reported to CDC between 2004 and 2014. An epidemic of rubella, or the German measles, in 1964 to 1965 infected 12.5 million Americans, killed 2,000 babies, and caused 11,000 miscarriages. Since 2012, 15 cases of rubella were reported to the CDC. So given the success in these 3 points here, it might seem reasonable to ask, why should we keep vaccinating against diseases that we will probably never see? So before we go and answer that question, let's watch this video about the origin of vaccines and how the whole vaccine started.
Because their skins were famous while the smallpox were lost. They were attractive and resistant. But why? That's what the rural doctor Edward Jenner was trying to understand. He knew that milkmaids got small blisters on their from cowpox, a mild disease that cattle suffered from, which caused similar lesions to smallpox. And this phenomenon made Jenner think that maybe cowpox and smallpox were related, and that infection with the milder disease would be enough to protect people against the lethal one. As a man of science, he decided to prove it. And to do this, he needed 3 things: cowpox that he extracted from a milkmaid, fresh smallpox from a patient, and a human guinea pig. He chose his gardener's son, an 8-year-old boy called James Phipps. He infected the child with cowpox, waited a couple of months, and injected him with smallpox. And James didn't become ill. He repeated the experiment with other patients with the same results. Jenner was right, even though he didn't fully understand how his remedy worked. The most remarkable thing was that his discoveries were made way before Jacob Henle proposed in 1840 that infectious diseases were caused by germs, a theory demonstrated by Robert Koch. Decades later, Louis Pasteur, inspired by Jenner's experiments, showed that attenuated microbes could be used to prevent diseases, and he proposed the terminus vaccine in his honor. Almost 200 years after Jenner's experiments, and thanks to global vaccination campaigns, in 1980, the World Health Organization announced one of humanity's biggest achievements: the complete eradication of smallpox, the most deadly infectious disease in history.
All right, let's go to the next slide. And to answer the question that we asked in the slide before the video, why should we keep vaccinating against diseases that we will probably never see? So vaccines don't just protect yourself. That means most vaccine preventable diseases are spread from person to another person. So looking at these 2 pictures here, if one person in a community gets an infectious disease, he can spread it to others who are not immune. So this picture here on the left side of the screen, if the red one means not vaccinated, sick, and contagious, yellow one means healthy and vaccinated, blue one means healthy but not vaccinated. So if one person in the community is infectious, um, got an infectious disease, he can spread it to everyone in the community, either healthy, non-vaccinated, or others who were already didn't have the vaccine. So the virus would be spread all around the community. In the one to the right, um, if a person who is immune to the disease, because she or he has been vaccinated, can't get that disease and can't spread it to others. So the more people who are vaccinated, the fewer opportunities a disease has to spread around the community. And this is what this picture or this graphic here shows, that there is one red, which is not vaccinated person, and three blues, which are healthy but non-vaccinated. The rest of the community in this side are healthy vaccinated. The odds of the virus to be spread is minimal if everyone in that community is vaccinated. So if one or two cases of the disease are introduced into a community where most people are not vaccinated, outbreaks will occur there. So if vaccination rates dropped to low levels nationally, the diseases could become as common as they were before vaccines. And in this slide, we will discuss how immunity protects us from diseases. So diseases that used to become in this country and around the world, including um, polio, measles, diphtheria, pertussis, um, um, or pertussis or the whooping cough, rubella, mumps, tetanus, or Haemophilus influenzae, can now be prevented by vaccinations. Thanks to vaccines, of course, one of the most terrible diseases in the history, which is smallpox, is no longer exists outside of the labs. Over the years, vaccines have prevented countless cases of diseases and saved millions and millions of lives. Um, so this is a little picture here to show that a weakened form of the disease germ is injected into the body with the vaccine. The body makes antibodies to fight these invaders. Those are the antibodies. And then if the actual disease germs ever attack the body, the antibodies will return to destroy them. So this is how our bodies gets immunity to protect us from diseases. So the other question we have here is why immunize? There are several reasons on why to use the vaccines or immunizations. First off, all is to stop the spread of diseases. A vaccine can protect us um, immunized and to decrease the spread of that disease to others. To build community immunity, So by vaccinating most people in the community, we can protect the entire community from diseases. If enough people choose to not to get the vaccines, it leaves an opening for disease to break through and spread. So it's important for everyone to take part in protecting all members of the community. 3 is to protect people who are too sick to get the vaccine. So some people can never get vaccinated, like children with illnesses such as like leukemia or other cancer, heart problems, or even some kids with asthma are too sick to get some of the vaccines. Some teenagers, adults, and even elderly can also be too sick to get the protections from the vaccines. So by getting the vaccine, we protect them from getting sick. The fourth point here is to protect too young or too old to get vaccinated. So some vaccines can't be given to babies or the elderly because of their age, leaving them defenseless to the diseases. By vaccinating children on time, we build a community of immunity around babies and grandparents, so they all have a fighting chance. Um, Next point is to protect those not fully vaccinated and those who do not get full protection. So, no vaccine is 100% effective. Some people don't respond fully to some kind of vaccines, or its protection has worn off, and they need to get a booster shot. When most of us are vaccinated, we increase the protection for all. The next point is to strengthen the body's natural immunity. So the immunity gained from any kind of vaccines is similar to a natural infection without the risk of natural disease. Um, some studies show that vaccinated children suffer fewer infections overall than unvaccinated children. Some other reasons here are diseases are becoming rare to over rare due to vaccinations. As we just mentioned in a couple slides earlier, the smallpox is not really exist other than in labs. Keep immunizing until diseases eliminates. Um, Again, it's the smallpox or any of the other diseases that we just mentioned a couple slides earlier. By getting the vaccine, we protect the community from getting sick, as well as we are protecting ourselves, and we are eliminating and decreasing the diseases and the spread. Vaccines do not just protect yourself or ourselves. So it's for you, for your family, friends, for your community, and for the whole country and for the whole entire world to be safe and healthy. So back to the questions we have at the beginning of this webinar. The first one was myth or fact. Natural infection is better than immunization. That one is a myth. So natural infection usually doesn't cause better immunity than vaccination. However, the price paid for natural diseases can include liver failure, liver cancer, deafness, blindness, loss of limbs, or sometimes death. The second question is um, it is always best to get vaccinated even when you think the risk of infection is low. This one is a fact. So some deadly diseases that seem to have been all but eradicated have a nasty habit of making a comeback when immunization rates drop. So we should we should not really rely on people around us to stop the spread of disease. We all have to be responsible to do what we can to stop the spread. The third one is if we stop vaccination, deadly diseases will return. That one is a fact. So, even with better hygiene, sanitation, and access to safe water, infections still spread. When people are not vaccinated, infectious diseases that have become uncommon can quickly come back to haunt us again. So, if you have any questions about the vaccines, you should ask your health providers and maybe check with them to know what are your options. And since it's back to school season, we recommend all the kids to get the flu shots to be safe and have a good year at school.